Okay guys, Dr. Patrick Price here, the Body Detective. I'm going to give you a couple moves you should do every day. Now, I'm going to tell you if you're new to exercise and you've never done any of these things before, I'm going to tell you do at least 3 movements every morning. As soon as you wake up, get half a lemon, squeeze it in some water. Don't do anything else. Don't check your phone. Don't check your emails. And just do these 3 movements with me. Those of you who want to go to 5, I'll give you a couple more to do, but 3 movements. Create your own or follow what I show you. Watch closely. The squat. Some of you may not be able to squat very easily. Go down slowly. You may only get to here. Try to keep your heels on the ground. Now, if you cannot go down very low, see the door here? Hang up to the doorknob. And then squat down a little further. And see how low you can go as your heels are on the ground. And hold this squat. Those of you who don't need the door, go down to the squat and just hold the squat with your head up. Don't put your head down. And from here, take your elbow on the inside and just open your hip up a little bit. Open your hip up a little bit. From here, you're just going to get your hips open. This is going to help your sacrum, your low back feel much better, guys. It took me a while to get down all the way down, just like they used to do in the old days, called the primal squat. But this is how it works. Get to this position, hold it, and just loosen these hips up a little bit while you're inside the squat. Primal squat. From here, everyone knows the cat stretch, but that's not what this is. Take your knees, open them up, put a towel or pad on your knees if you need to. Come out a little further, and what you can do is take your lower abs and tighten your lower abs really tight, and hold it. Hold the contraction. So right through here, your lower abs come in and tighten and hold. And back again and loosen that low back. See if you can drop my low back down. Come in and tighten and hold, squeezing. This is called the vacuum. Tighten and squeeze and hold. All right, once you do a couple of these and hold till you really feel your abs nice and tight, then go into this movement here, the V. Everybody knows this from yoga. I have really tight hamstrings. So if you do too, wonderful. Drop your hips and look up. Walk back a little bit. Tuck your chin. Drop your hips again. You can go to your knees if you need to. Just look up. In most positions, you can see it all positions. Drop and look up. And once you're here, once you come back up, especially those who have a tight low back and tight hamstrings, just go ahead and let your body hang a little bit. Put your fingers on the ground. Just a nice little stretch through your hamstrings and your low back. Now from here, I'll move over and twist a little. And twist a little. Adductors. Stretch your leg out, push it down to the floor. 1, 2, 3. Go out a little further, push it down, and stretch. Just go to where you're comfortable. Make sure there's comfort under your knee as well. Switch sides. You get the other adductor muscles. Head up on your knee, and just push the foot down. 3 to 5 seconds. Reach out a little further. Now from here, you've done basically 3 types of movements. For those who want to go a little bit further, I'm going to add 2 more. Once your foot's out to the side, put your toes up and get to hamstrings. Push the foot, don't lean so much into it and hurt your back and hurt your hamstrings. Push the foot down and let the legs slowly stretch. If you need a chair to balance on, something to put to the side, that's fine. But push the foot down to the floor and then go a little further out and push down. Switch sides here and push the foot down as well. Let the foot come out a little further, and once again, relaxing the hamstrings, pushing the foot into the floor. So now you've got your adductors, you've got your hamstrings, and now most important for those who have a tight back are your psoas muscles. As I turn, notice where the knee is. If I put the knee back a little bit, and look what I'm going to do. I'm going to stretch that psoas, that one deep inside the body. when I get in this position, never letting my knee come over my toes here in the front. I'm going to try to pull the knee forward for 5 seconds. 3, 4, 5, and relax. And I'm going to take my foot and come out a little further and stretch this down a little bit lower. Now you can let your foot go down if you like, your toes out, or keep your toes up, doesn't matter. And once again, pull forward. Those your knees hurt you, make sure you put some kind of pad under the knees. Here, same thing, keep your head up, pull the knee forward. From here, let that foot come out a little bit further, go down a little bit further, and pull the knee forward. And from here, watch what I'm going to do to come up. My toes on the ground, I'm going to come backwards. So as you see, those are 5 movements to do in the morning. The first 3, very simple. The squat, I recommend doing that with the door. Get down when you get to the floor. And then doing that vacuum to tighten the lower abs. Everyone has weak lower abs. Everyone's got stronger ones when they do sit-ups, but the lower abs, very important for your core, keeping the low back healthy, guys. And then from there, you see me going through the yoga movement, the downward dog, upward dog. So I'm Dr. Patrick Price. These are your 3 and even 5 movements that you should do every day. And I'm once again Dr. Price, the Body Detective. Take care.